I'm Dr. Matthew Stern, and I'm here at the 17th International Congress of Parkinson's Disease and Movement Disorders in Sydney, Australia, and I'm delighted to be interviewing Professor Eldad Melamed. Good afternoon.
Good afternoon.
Let's start by talking about your early years.
All right. First of all, I have to say that I couldn't ask for a friendlier and nicer interview.
I feel the same way.
That's really a pleasure. Well, about the early years, I was born in Israel, in Tel Aviv, to parents who came from Central Europe, from Poland, just before the Holocaust. So they actually escaped Europe at the right time. And
this was obviously before Israel was a state, so
right,
Israel was just
right,
a territory.
That's right. They came, I think, in the 93, 95, 96, something like that. And I went to kindergarten, public school, high school in Tel Aviv. Very happy years. Tel Aviv is a great place to be a young person in, and definitely the schooling system was great. And then I knew for a long time that I wanted to become a doctor of medicine.
How did you know that? Did you have anybody in your family? What made you think about becoming a doctor?
My father actually, not that it had anything to do with it, but my father went to medical school in Berlin. He escaped from his home in Poland, went to live in Berlin, and started medical school there. And I think he studied, he never told us exactly how many years, about 3 or 4 years. And then something happened that made him very frightened, and he decided to leave on the spot. We had many versions about how he decided and why he decided to leave everything and go to Israel, which was at that time Palestine. There was no medical school, and but that he did, and the rest of his family came after him, and that's why they survived.
What did he do? So he never finished medical school?
No, he never finished medical school, and I don't think that my decision to go to medical school, he was very happy about it, my late father, but he didn't try to convince me. There were no talks about that, neither my mother. I think what they wanted me is to be a mensch.
That's what you are.
Whatever. Thank you.
So they were right about that. They got that part right.
You are lovely. In any event, in Israel, you have to do a regular army of 3 years. Okay. And I elected to go to medical school first, become a doctor, finish the internship, and then go to the army for 3 years of regular service.
That's not, you're in the army, are you an army doctor at that point?
Yes. There were 2 choices, either to do the regular service before going to medical school, or do medical school and become a doctor, and then serve as a military doctor in one of the fighting units.
When was that in the history? Was that?
That was in the 1970s.
So well after the '67 war and all.
Right. So after finishing medical school, I went and joined one of the infantry battalions and served there for 3 years. It was one of the best schools I had in my life. Quite an experience. And then, of course,
doing general medicine, or
no.
Or being an infantryman?
Doing general medicine, but you do lots of other things when you are a military doctor. So it was a very active period at that time with the attrition war and skirmishes with the Syrians and the Syrian border. It was a difficult time. And then, of course, just finished my regular service and then started my training in neurology at the Hadassah.
And where did that interest come from? What spurred your interest in neuroscience?
I always knew that I was interested in the brain, and when I was in medical school, the thing that we started anatomy lectures, and I had a fantastic teacher in anatomy who used to come earlier before the lecture and draw on the board with painted chalks all the connections of the brainstem and the spinal cord. I wish I could photo them and have them with me today. Really so artful. But that is not the reason I was drawn to neurology. I mean, we started with dissecting the brain, so it was, of course, fascinating. Mm-hmm. The reason is that nothing was known about it. It was just... so I thought that there was so much to do, and it would be nice to go into a profession, one of the specialties that nothing is known. I mean, very nice diagnosis even at that time.
Were there established departments that were?
There were established departments at that time when I finished medical school, good departments. In Jerusalem, definitely, the Hebrew University. That's where I went. Although I was born in Tel Aviv, I studied medical school in Jerusalem at the Hebrew University Medical School at Hadassah, which was a fantastic school. And then I went to the army, and then after I finished the army, I decided that I really want to go into neurology. I looked around and decided about the department in Hadassah, and that's where I did my neurology residency training, stayed there, became a professor, full professorship, the whole academic.
You're jumping way ahead. I want to find out,
Yeah, all right.
who influenced you with that? Were there role models that led you into our field at that point, or had you not got there yet?
Into neurology, I knew that I wanted to become a neurologist because I was fascinated by the brain, the mystery of the brain, etc. It was fantastic. But in these anatomical lectures, the first thing that drew my attention was these two black streaks in the upper part of the brainstem. We used to cut the brain, and all of a sudden these two black lines appears in the upper part of the brain. I was fascinated by it. Since then, so this is very interesting because I talked to my teacher in anatomy, a very fine gentleman from South Africa he was, and he said, listen, this is the substantia nigra. The reason for this color, the black color, is a pigment called neuromelanin. I can't help you anymore. I know nothing about it. I don't know what is it for, why it should be there. But there is a paper in the Journal of Anatomy by a certain person called Marsden. I'll try to get it for you. We were students at that time. Who knew anything about going into a medical library to look for... But in due time, he got me the paper, and at that paper, you probably saw the paper. The paper was fascinating. David made contracts with the zoo in London and got the brains of every species that died in the hospital. And he cut the brains and looked at the substantia nigra to find which animals have pigmented substantia nigra. And he published that in the journal, and I was fascinated. Later, many, many years later, when I spent time as a visiting professor with David, that came up, and it was really a fantastic.
Was that your first sort of entree into the world of Parkinson's disease?
Yes, I think so. I think so. I was fascinated by this region of substantia nigra, and I thought, how many cells could be there? Later on, it was found out that there are only 400 to 600,000 cells in this region. They die slowly in Parkinson's disease. When it was found that this is the major site, we were led to believe that this is the only site. So I thought to myself, it should be a great problem to find out what kills off this very, very specific neuronal collection. And by finding out what kills them, it would be probably not much effort to find out how to stop it.
Right. And was that one of your earlier research questions? And what was the early part of your research?
No, surprisingly not. Although I was very interested in Parkinson's disease, and I did a lot. First of all, when you are a resident, you know that you don't have time to do much because you are, I always liken it to a slave chained in a Roman warship, or a slave in the salt mines of Judea. So you don't have time. But when I had time, I established together with one of my teachers a laboratory for blood flow examination. So I became an expert in regional cerebral blood flow examinations, studies, and even went as a resident for a short while to Copenhagen to study with the late Niels Lassen in his laboratory how to measure blood flow. I was at King Square with Lindsay Simon and his baboons and platinum electrodes. So I really became an expert. But after a while, and even I did some blood flow studies, all of them were published in Parkinson's disease. But then it was too much of a phenomenology. There was not mechanistically explanatory data that I could expand on. So you measure blood flow, and of course it's fascinating.
Was it because we had that tool? That was regional blood flow measurements were sort of the early PET scan.
Yes, precisely.
We had this tool, and we took it, and you.
And in fact, I went to Copenhagen because Lassen developed this fantastic machine with 124 pixels that really show pictures that even today I think are much nicer than PET scan and the MRI. And I remember I went there with a mission to study where is the center of saccadic eye movements in the frontal cortex of men. And it took a while.
So nothing really to do with movement disorders at that time?
No, but I was interested in the motor control of brain. So after fighting with him because he thought nothing, he didn't think the resolution of the instrument will let us look at it. So he said, no, join another group that is working on aphasia. But at that time, I succeeded in convincing one of my colleagues there to do just one shot of xenon, isotopic xenon, just when the patient moves the eyes and see what comes out. And it was really fantastic because a red cherry, came up in the frontal eye field. So we published that in the Annals of Neurology, and I think it's one of the best papers I've ever published until today. So it was nice.
Well, that sort of brings us to an important question. As you look back, what would you say your important scientific contributions have been? Because you moved on to do a lot more related to Parkinson's disease.
Right. I was very interested in Parkinson's disease for many, many reasons. And ever since my anatomy lecture that I told you about, Matt. But I wanted to look at the chemistry, biochemistry and pharmacology of this fantastic collection of neurons, the dopaminergic neurons. I was really fascinated by dopamine, by Levodopa that came out at that time. So I decided to go. I was, at that time, I wasn't, except for doing this short fellowship in Copenhagen and 1 month in Queen Square, I was not yet in the States, so I looked for a place in the States to do a fellowship, a long-term fellowship. It's very traditional for Israeli doctors, if they want to go into academia, to go to the States, yes, to establish themselves. And I went to MIT, to Massachusetts Institute of Technology, and stayed there for 2 to 3 years, the Department of Neuropharmacology, Neurochemistry. I met Franz Hefti, who's a very, very well-known scientist. We teamed together, and I came with an idea in mind. I wanted to find out where is levodopa converted to dopamine in the brain. After all, the dopamine neurons are gone in Parkinson's disease. Where is the decarboxylation takes place to explain the efficacy of levodopa? Because it was believed that most of the dopa decarboxylase that decarboxylates dopa to dopamine, the exogenous dopa, is located in the terminals. And once all the terminals are gone, there shouldn't be any more effect. But that was not the case, because we have seen, even in my experience as a resident, just finishing my residency, that you could really get fantastic responses and even more dramatic responses in the more disabled persons. So there must be another mechanism. So Franz and I worked for almost 2 years on where is the levodopa decarboxylated in the brain of the Parkinsonian patient, and we used many, many experimental animals. We knocked out, we killed different populations of neurons, gave levodopa, measured dopamine concentrations, levodopa. So we looked at serotoninergic neurons, blood vessels, glial cells, other neurons. It was really a fantastic odyssey at that time.
And this was during that 2 years.
During
did that
those
work
2
extend
years,
beyond
2 years, 2 years and a half of fellowship.
Right.
And indeed, we made quite a name for ourselves because this was a very, very fascinating, enigmatic questions.
Mm-hmm.
And ever since I was fascinated by Levodopa. So,
and then you went back?
yeah, then I went back and established my own laboratory at the Department of Neurology at Hadassah and continued to work on Levodopa and find out again why it works, not only why it works, what are the mechanisms that are responsible for the change in the pattern of the efficacy of Levodopa. Why is their honeymoon lost, paradise lost in these patients who initially respond so dramatically well to Levodopa? What is governing this change in the pattern of responsiveness to Levodopa? And why do they develop these kinesias, which is a very limiting problem?
And that really defined your career,
yes,
your scientific career.
I've done many things in Parkinson's. It's not that I have to brag about that, but Levodopa has been a source of fascination. So, for instance, we work to develop Levodopa ethyl ester to try and overcome this problem of absorption of Levodopa to make it more soluble. Unfortunately, we reached phase 3 and failed. Phase 3, as you well know, Matt, is the killer of all good ideas.
So, you've seen so many amazing things happen in our field, and you're in a unique position to predict where you think the field is going because you've worked on many of these areas that you think may have had a major impact. As we sit here now in 2013, where do you think the field is going? What are we going to learn in the next few years that's going to revolutionize the field?
Although everything was laid before our eyes, for a long time we were led to believe, and we wanted to believe that this is really a very limited disease, a focal disease of the central nervous system. This is what I said before. Just solve the problem of the dopaminergic neurons. So most of us were working on all kinds of mechanisms to explain why would the dopaminergic neurons be so sensitive and vulnerable in Parkinson's disease. Oxidative stress, iron concentrations, glutamatergic toxicity, actually the usual suspects in many other neurological disorders. And it was just before our eyes that this is a very complex disorder with, as you are working very nicely on now, with a long premotor period, lots of non-motor phenomena. So the substantia nigra is not the only place, and not even the first place to be attacked by Parkinson's disece.
Was that hard for you?
Complexity,
was that a hard thing for you to accept, given your?
Not at all, because
did you embrace it?
Very easily, because many of my patients told me, "Listen, I've lost my sense of smell 15 years ago. I'm constipated as far as I remember myself, and so on." But not all of them, which is not all of them. So, as always in medicine, so the field, first of all, has gone to understand the complexity of the disorder. It is much more complex than Alzheimer's disease and Huntington's disease because it affects so many regions in the brain which are apparently not even similar to each other, and also the peripheral nervous system, especially the autonomic nervous system. So that's one thing. Then, of course, the story of the misfolded alpha-synuclein as a possible killer of the dopaminergic and other neuronal populations. Why does it kill the cells? Is it responsible for the propagation of the disease from one cell to the other? I wouldn't like to use prion-like because it is not a prion. And we don't have time to discuss why it is not a prion.
But so this is this the area you think
will
be unfolded?
Well, I think to me it is less important to decide when does Parkinson's disease start, where does it start, even why does it start. The major thing is why does it progress, because if just a few cells would have been killed by a sort of an obscure cause, then we wouldn't even mind. It is the progression that goes on from the beginning to the end, that spans so many years, 20, 25, 30 years. I now have patients whom I've been treating as a resident. They are still alive, of course, demented. They are bedridden, etc. So that's the second thing. And of course, the cause, how to stop the disease, and how to cure it without even knowing what is the cause of death. So that's why in the last 5 to 6 years, even more now, we have switched our research in the laboratory to a total new field, and we research stem cells, adult stem cells, because we think we could bring them faster to the shelf. And that is what we have been doing for a while. We are.
So how do you feel? How do you feel about it? Are you optimistic about stem cells? There's a lot of
optimistic.
A lot of caution about it.
I'm cautiously optimistic, but it has to be tried. I mean, there's been a lot of hype about stem cells. There's no question about it. And Yamanaka got the Nobel Prize for IPS. I'm going to give a talk on IPS at this meeting. And I'll have to criticize it for reasons that will become clear. The problem is what cells to choose from, embryonic or adult stem cells. What are the risks? What should we use? Should we use differentiated cells? So for instance, what we have done is we have taken bone marrow derived adult mesenchymal stem cells, and we can convert them easily to dopaminergic neurons. But I don't believe in simple replacement therapy. So we have converted those cells into astrocyte-like cells that produce large amounts of BDNF, GDNF, VEGF, so that they will be hopefully used as nanopumps that will release this type of trophic factors, and we will overcome the problem of delivery of these proteinaceous molecules.
So what you're saying is it's more what these cells will secrete.
Exactly.
And not necessarily that they will serve as an in vitro supplier of dopamine. That's not the
precisely. No, that's not where we are going.
So let me switch gears a little bit, because many of our members watching this interview are really interested in you as a person and you as a mentor, and I know that mentoring young professionals is something you really enjoy doing. What advice would you give to a young scientist entering our field, a young neurologist, in how to successfully pursue the field of neuroscience research in our field?
That's one of the, yes, definitely. I love teaching, and I teach all the time. And I think that I have many students in medical school and many residents in different professions that came to my department and were taught by me, by my team. The way I saw neurology, the way I did neurology, and I know that you did too, is to be an academician neurologist. A neurologist that would be a superb clinician, but at the same time will be also a scientist and a teacher, of course. It goes together. Unfortunately, by the way, this combination is a winning combination. And I cannot even think about how would neurologists today wouldn't find this exhilarating, fascinating. That is what they want to do for the rest of their lives, because it is a fantastic adventure that still excites me.
Right.
But unfortunately, the neurologist academician is a dying species. We don't see that as often as we should. And there is less and less people who are interested in doing both clinical neurology.
Is it they're interested, or is it that it's harder to do?
It is harder to do. Yeah. It is harder to do. There is a change. So if you have a solution for that, I would be very happy to hear it. But we should encourage it, I think.
And so because we're all interested in your career, and I think I know the answer to this next question, but I'll ask it anyway. If you had to turn the clock back, is there anything you would have done differently in either your research or clinical career? I want to ask you about your personal career.
Even about my personal life, I wouldn't change anything. I think I'm blessed. But with my professional life, I wouldn't change anything. I mean, it has been really a big adventure. And surprisingly, I still enjoy it. I'm still involved in basic research, in clinical research. We do new projects every year. And again, this is what I would tell younger neurologists. I find myself, I find it difficult to talk about it because I myself feel that I'm just in the high school period right now.
Right.
But this is what I would advise. Mixing clinical neurology and research. There's nothing better than that, nothing more exciting.
And that excitement is infectious. And what about, you've been involved with this society since its beginnings. Can you tell us a little bit about what the society has meant to you, what your role has been in the society?
Well, I've done a few. Let me start first with the society, the importance of the society. I think it played a very important role in my life because this is a milieu where I could find people to talk to exchange information, to present my research findings, get criticism, etc. So this is a fantastic milieu. I think I'm grateful. I served in several posts in the society, and I was very happy about that. To top it all, I have to say that the group of people that I met in this society, I mean, they became lifetime friends. Quite a large group of people that I'm really grateful of having met them. And meetings in the society, and probably also in other situations and locations on the planet, but really lifetime family-like friends that I enjoy meeting, and very supportive, critical when they have to be, but helped me a lot on my way.
And a long way to go yet, I'm sure.
Hopefully.
Did you, any biases, barriers, obstacles to your path along the way that might be useful for some younger members to hear about?
Not personally. No, I never had that. Not biases. I think I was fortunate not to run into things like that. Being an Israeli, probably avoided problems of being Jewish. Being a male, I probably avoided the female problem, but it's changing. In our medical school today, 70% of the students are females. Mm-hmm. In my previous department, now almost 80% of the residents are female residents. So it's going to change. Mm-hmm. It's always a problem of getting money, financial support for your study. The competition is ferocious. It's very, very difficult. And living in Israel and away from the major tables of where the food is coming from, we get just the remnants that falls on the floor, I guess. Right. But I hear from my friends in the States and in Europe that they have hard times as well.
It's true. Is there anything else that you'd like to say that we haven't covered? You've had such an illustrious career. And
definitely, Parkinson's disease and movement disorders are so fascinating that once you're enmeshed in it, you ask yourself, I mean, how could people be interested in other fields of neurology? Right. And why would people not be interested in neurology, but let's say in urology or dermatology? But the other thing is, if I had time, I would read all the relevant literature coming from oncology, cardiology, dermatology, because maybe the answers...
There's a clue in there somewhere, right?
Maybe there are clues there that we miss because we don't have time.
Well, you once told me that your mother and father didn't care whether you were a doctor or not. All they cared was that you were a mensch. And for that, they have succeeded royally.
Thank you very much,
Thank
Matthew.
you.